How about the electric toothbrush versus the manual toothbrush? I discuss these things with patients all the time. It is difficult to change our habits. When I started practice, I was always of the idea that a manual toothbrush was more than adequate to brush your teeth, especially if you were doing it correctly. And I do believe that a manual toothbrush used correctly does a good job. But I don't think there's any arguing that a good electric toothbrush does a better job. And my preference, our preference in the office, is the Oral-B versus, for example, Sonicare. I think the Oral-B is better because I like the oscillation of the brush versus just the vibration of the Sonicare. I also think that the Braun does a better job at stain removal. I know it does a better job at stain removal, and I have seen more patients who get good at using the Oral-B have better checkup reports than patients either using a manual toothbrush or a Sonicare. And those are just my observations. I think that you can be effective using anything, and I think that some people can get away with being less aggressive maybe than others, but in general, a good electric toothbrush like a Braun Oral-B has to be one that sits in a charger. Cannot be one you put batteries in the underside, AA batteries in it. That is not strong enough especially for an adult. Okay, maybe for a child, but not for an adult. You need one that sits in a charger. And it is an investment. It is an investment. You need to spend at least probably $70, $80, $100 at least to get a good one. But it does make a difference, and it is better for your dental health.